Hey, what's up, guys? Jay, and I've got a really interesting case for you. Rather, this was a approximately 30-year-old female coming in. She's coming in complaining of predominantly left-sided neck pain, and she works for this kind of hair. She's an assistant for sort of a hair transplant surgeries. So she's always constantly in kind of like a flexed neck position, a sustained kind of flexed neck position, leaning over to perform these surgeries, and that can be an unchanging position for a fair few hours. And it will also be slightly rotated. And I've seen this before with people like, similar to dentists actually, have somewhat of a kind of similar complaint, and I believe stems from the same reasons, i.e. That fixed, sustained, sort of slight torsion or sort of posture and flexed posture. I have a personal experience with this. I remember going to see a Russell Brand show and I was sat sort of left of centre stage, and to see the stage I had to stay turned to the left. And after a while, just before we hit the intermission, I was like, oh my God, like I had this, and I have no real history of neck pain, but my neck was killing me just from being fixed in that sustained posture, sustained stress to specific tissues and joints. Anyway, so her right side flexion was pretty good. It was a little bit sore, but her range was decent. It was like 40-45 degrees. When we went to the left, it was a very prominent kind of block, and she got maybe 25 degrees at a push, and it was painful ipsilaterally and notably restricted. So we take her into supine and I test it again passively, and the range is actually equal both sides. She's getting all the way down to here bilaterally. There's still some pain there, but the range was very significantly different. We weren't hitting that block or anything. So what did that tell us? Well, like that old thing, if you've watched any of my ramblings, is that that discrepancy between active and available range, if range and or pain, there's an inconsistency in different positions. So i.e. if you find that pain and range suddenly become increased range, less pain, or a combination of two when you go from sort of active versus passive, standing, sitting versus supine, where the demands of kind of gravity on those postural muscles are much less. Nervous system feels safer, and it grants you that increase in motion. If there's an inconsistency, we're not dealing with we're probably more dealing with a stability motor control issue. That being said, is that I had to feel like sort of AP moves, PAVIMs, and found some sort of stiffness through, particularly for a lower cervical spine. So I did some kind of moves. I took her, because she was non-irritable, I took her into that position, like right, left side flexion, right to the point where the pain come on, back off a little bit, do the moves in that position of restriction. Felt fine. I could push. My goal was to kind of increase that range, increase gapping. I'm looking at this with my mechanical pair of eyes now, so I'm going kind of more like grade 3, grade 4, if you are familiar with the kind of Maitland mobilization. So that's what I'm doing, and then I worked on the sort of soft tissues on that side. So we found some increased tension through her SCM on the left, some increased tone through the upper traps and scaling. So I did some instrument assisted, generally sort of slower strokes. There was definitely a really big point of where the tool slowed down, and there's a big kind of not restriction, but a big increase in tone through those upper fibre traps towards the kind of acromion across that sort of spine and scapula. So worked on that. Now, as the soft tissue got better, the range honestly was the symptoms were a bit better, but when we came back to sitting, the range was still definitely restricted. And I was like, no way, and this isn't beating me. So we took a step back. I found, interestingly, that just to kind of add some more evidence to my theory, is that when we flexed certain and side flex, it was much better. When we extended her inside flex, it was much more, even more markedly restricted. So I'm like, okay, this is compression intolerance rather. This is kind of articular. This is facety, and the joint mobs definitely helped with that. After I'd done the joint mobs, it was better, felt better as well. And then to regain that last bit of range actively in a weight-bearing position, upright position, I've had success doing the kind of lower traps cues, like cueing kind of like isometric shoulder depression ipsilaterally, and with some people it works a treat. With her it wasn't doing anything, so I tried something different. I went into kind of like a sort of like a kind of wall plank, wall press up kind of plank position. So she's got both hands on there, widen out her base of support. I want her to feel stable. I want that nervous system to feel reassured. And I get to do a base like an isometric scapular push up, and then repeat the offending movement. And pain's gone, range of motion all the way down, equal both sides, 45 degrees or whatever it was. And it was a big win. So that's, I'm honestly, I couldn't tell you how much I'm seeing these presentations where the patient is convinced that it's kind of like a tight muscle that needs to be stretched mobility issue, is that there's not always, but almost like recently, over the past couple of weeks, like almost like 99% have this inconsistency in that standing and sitting restriction painful, lying down passively full, and pain free, either pain reduced significantly and if not pain free completely. And that, to me, you find that evidence, and you just know that it ain't going to get better just doing stretching. It just isn't, because there wouldn't be that inconsistency if it were purely just down to mobility issues. Taking all the soft tissues through the same range, the same amount of stretch, the same amount of stress, but that difference between that you have a window, you have a view, an appreciation of their actual available range, and it's an issue that they're not able to access it, and their body removes their stretch and movement tolerance. I believe because, in part, the nervous system prioritizes safety and security above all else. If it feels you have an inadequate stability into a certain movement, posture, position, it will lock you out of that. It's holding all the keys, and it's taking them for safekeeping. And so, if you want to be giving them back, you have to reassure the nervous system. You have to impart some level of convincing kind of sense of stability around the neck and the shoulder girdle, thoracic spine, and that's kind of the way I kind of view it now. Is it rather than just being like this, it's this. The whole thing. You think if you are interested, or you're familiar with the joint by joint approach, they talk about cervical spine primary needs stability, thoracic spine mobility. I don't think it's just clear cut as that, but I mean, I just bring that up to raise the point about the neck where you get pain. It's definitely not all about stretching or anything. If anything, quite the opposite is that I found that you can get really great results with doing no stretching, even though the person is feeling tight and restricted. You do this most controlled type interventions, and you can have very quick, instantaneous, awesome results with regaining range of motion, reducing pain. Okay, that's it.